Okay, gang, we have Frank here. Frank is one of our Invisalign patients, and we're going to talk a little bit today about adult Invisalign treatment. Frank, how long have you been in treatment at this point?
Probably about 9 months.
Excellent.
Yeah.
And why don't you tell us a little bit about the experience? How's it going so far?
It's something that I actually adapted to, I think, reasonably well. It has not been totally, very eventful. Initially I wasn't sure what to expect, but you kind of create good habits and you stick with it. And me personally, I probably adapted here and there in terms of how frequently I take them out or what do I do when I'm going to have a snack or eat. But you kind of find what works for you, and I feel like I've adapted pretty well, and it has not been that big of a deal for me.
And then I know too that when you first came in to see us, you had some concerns about the whole process and how it would fit into your lifestyle. So have you been, hopefully, you've been pleasantly surprised that it's not as hard as you thought it would
Oh,
be?
no, absolutely. Initially, especially when you're an adult, and you figure, well, you're going to have braces. I actually had a coworker who had used Invisalign that sort of made it seem a little more feasible to me. She was a CEO of a company, and she went through the process and without sort of skipping a beat. And it was not that big of a deal. Again, it's creating good habits for yourself. You adapt to it, and it's been actually in a good way uneventful.
That's great.
You know.
You and I were talking before a little bit too about some of your concerns that you had as far as retention.
Right. Yeah. I wasn't clear initially that it was the kind of thing that on a maintenance go forward basis that you'd need to use a retainer in the evenings. So when I initially heard that, I sort of stopped and think about, do I really want to go through with this? But I decided to do it anyway. And now, having gone through the process, the actual remedial process. It certainly is much more feasible to me that wearing them in the evenings is something I've adapted to wearing them 22 hours a day or more, and wearing them in the evening does not seem like that big of a deal to me any longer.
Yeah, that's interesting because we find that actually with a lot of the adult patients that once they get to the point where wearing the retainers just at night, it seems like a vacation.
Yeah, not that big of a deal. There's something that you adapt to. So.
Excellent. Anything else? Any other advice that you would give to a prospective adult patient considering Invisalign?
I think everyone probably depending on your own particular lifestyle, how often you eat, out or you eat with company or friends or whatnot. You kind of find your own techniques in terms of when you want to insert them, remove them, and whatnot. You kind of find what works for you. It's not that big of a deal. Me personally, I kind of just, was, I think, fairly diligent about, keeping them clean. And so I kind of just felt like I was doing the best I could during the whole process.
Yeah, no, I think you've actually done very well. Your teeth are tracking beautifully, and your progress to date is really as good as it could be. So I'm actually very pleased with your treatment, and I'm happy that it's been a smooth experience for you too.
It was actually my wife's idea to consider it, and I think she's pretty happy about it too. So.
Well, there you go. It's funny actually. A lot of male patients, adult patients, come in and their chief complaint is that my wife wants my teeth straightened. So you definitely fit that profile too.
Yeah, I think you kind of notice it sometimes in photos. That look, my teeth. I think my wife sort of points them out in photos, and I think that's maybe one of the things that caused her to maybe to consider it. And I think there's no question that it's been a big improvement.
Well, that's we're really pleased. We're happy that your treatment's going well. We're also happy that it's been a nice, smooth experience for you, and I'm sure that wrapping things up will go pretty quickly too. But we really appreciate your time today, and
sure, you're very welcome.
We'll have to show your befores and afters when we're done.
Sounds good.
All right, thanks again, Frank.
Okay, you're welcome.